Hi, I'm Dr. Russ, chiropractor and neuromuscular therapist in Portland, Oregon. In this video we're going to look at Tessa's spine, ribs, and right shoulder. So you can see by looking at her that she has a little bit of a scoliosis here. Not much to tell in the lumbar spine. Looks like might be able to see a little rotation with it farther back on the left, forward on the right. But the spine looks more or less midline here, which means it may be shifted to the left and then rotated back this way. But definitely there's an obvious deviation here in the middle and lower thoracic spine. And she feels tension here a lot. Now she's 28, and in patients who are in their late 20s with scoliosis, you find very often that there is chronic pain. She takes very, very good care of herself. So she's really been able to limit her painful area to this part of the spine. And as I palpate in here, definitely feel some knots in the muscle there, and feel that this right scapula is being pushed forward and up by the rotation of the ribs on that side. So what we're going to do for her today, we're not going to try to correct this curve. There's no way that you can just adjust this curve back into place. So what we're going to do today is work her scapula back and down, which means stretching and working the pectoral muscle, the serratus anterior muscle, and then once that is done, she can lay on her stomach and we can do some muscle work in here and give her some relief on this pain that she has. So we'll start with you laying on your left. And we're going to work the pectoral region, and whenever I'm doing that on a female patient, I want them really covered. I don't want them to be worried about being exposed. So what I'll do is I'll put a towel down over their breasts, and I want their downside hand to hold the towel on. Okay? If I'm working in the pectoral region, if her hand is a little lower, then it's out of my way. Okay? So move your hand just for a second, and what we're going to do is bring this like that. Now you're covered, okay? So if you feel like you need more coverage, just let me know. So we can see her axilla here. Here's the side of her pectoral muscle. And we can bring the palpation all the way down to the fifth rib, which is the lowest part of the pec minor. And it's really the pec minor that I'm most interested in these shoulder problems. And right in here, we have some fibrosity and some tenderness here. And you can just see my finger gliding over that, and it sort of snaps under my thumb. Right there. Okay, that's a bunched up, fibrous, chronically short muscle. So it doesn't, you may not be able to tell, but I'm not pushing very hard. And I'm not trying to clear this out all at once. We want to start slow. Right now, just kind of saying hello to the muscle. So now I can start to induce a little movement in her scapula by using her arm as a lever, bringing that scapula back and down. And as I do, running my finger along the pec minor from bottom toward the top, slowly. Now her tissues are guiding the speed that I'm going at. I don't want to just sort of plow through this. Let's give it 1, 2 more in this direction, and let me know if you need a break. Got to keep your fingernails trimmed for this. Okay, now we're gonna roll opposite. As her arm comes up and we stretch the pec, I'm actually going to bring it down and stretch it in the other direction. And I would think, you know, she's really healthy and has healthy muscle in general. She is pretty short and tight right in here. After 3 or 4 treatments like this, I would be able to get my thumb underneath her pec minor, between the pec minor and the rib, and really release it all the way. But that's not something you want to try to do all at once. So let's move her hand up a little bit and look at the serratus anterior muscle. And that's the one that wraps around the ribs this way. And again, using her arm as a lever, feeling for how well her scapula moves back And up here at the upper part, it actually has some pretty good movement. But when I get down to the lower part of it, it feels really stuck. And right here, there's some bunchy muscle, and this stuff is really tight. So that's where I'm going to focus my energy right now. And again, this is really sensitive on people. You don't want to just go in there real quick. See, I'm keeping my fingers flat and gliding along the ribs. Tessa, I'm just going to show what I don't do. I'm not going to curl my fingers and rake like that. Okay, if you want to really get in there, you keep the fingers flat and just barely flex the tips of them, and then you can roll it around this way. But her muscle's not quite ready for that. So for now, it's just a really gentle stretch. The skin, the connective tissue underneath the skin, and then the muscle. You can really see the bunchy right about here, where it starts to snap a little bit under my thumbs. And this muscle comes, it wraps along the ribs under the shoulder blade, and that's where I'm trying to get right now, right here. Now when I looked at her spine before, I could see that the apex of her scoliosis was about T7. So I'm interested in knowing where the 7th rib is, because I would imagine that that would be where the most strain is. So we're going to count up and find rib 7. Here's 12, 11. So that's 10, 9, 8, 7. Right here. And that's right where we're feeling a lot of knots in this serratus anterior muscle. So we're going to bring it, see my fingers against the ribs. I bring the scapula out of the way, and I follow that muscle right under the shoulder blade, just like that. And she's not quite letting me in, and that's okay. We don't have to do this all in one day. With the serratus, sometimes it's 5 or 6 sessions before you can really get under there. But I want to get some extension and mobility going in each treatment so that each treatment gets her a little closer to where she wants to be, which is looser through the ribs and the middle back. Just a few more right here, right around rib 7. Mobilizing those muscle fibers, helping the circulation get in. Try not to overwork them. Her tissues feel pretty healthy in general, so I'm not too worried about overworking it. Okay. We've got her face down now, and the focus of her pain and problem is right in here, but the spine is one big functional unit, and we don't want to neglect any other part of it. So we're going to feel both sides, top to bottom, and try and address and identify as many problems as we can. And what's really clear to me as I come up along her right side is how restricted this is right here. There's 6 layers of muscle between the skin and the spine, and it can be very hard to feel them apart and tell them apart one from another. And in a back like this, right here where they're all bunched together, it's pretty much impossible. So all I'm going to have to do is approach this one layer at a time, and we're actually going to start with the skin. And I'm going to get the skin moving first. So there's a little oil on my hands and a little oil on her skin, and that helps me get moving. And then when I feel the skin is moving, I'll go a layer deeper. Now we're on the connective tissue between the skin and the outer layer of muscle. Not a lot of pressure. Is it very tender here, Tessa?
Not too bad.
Okay. That's what I'm doing. Feel all right?
Mm-hmm.
Good.
Feels great.
So just trying to work through it layer by layer. starting to really sort of make itself evident that it's the layer that goes straight up and down that is having the most trouble. And that makes sense because it's kind of having to turn a corner right here at the curve in her spine, and it's not really designed to turn corners like that. It's designed to come pretty much straight up. So since we can't make the corner go away, what can we do? We can make it as elastic, pliable, and adaptable as possible so that it gives her the least amount of trouble as it tries to do what it wants to do. Now the deepest layer in her spine are very short muscles that come this way, just like that. So in order to feel them, I'm going to go across that direction. And you can see my white thumbnails here. I'm pushing with a pretty good amount of pressure at this point. I'm not forcing it, but I'm getting in there. And if you're going to do this all day, every day, you got to take care of your hands and not overdo it. Just going to give it a couple of more minutes here, and then we're going to move up higher along the shoulder blade. So again, for her shoulder blade, we want to bring it this way, back and down. So I'm going to gently get a hold of her upper trapezius and give it a little stretch in that direction. Is that okay, Tessa?
Mm-hmm.
That's good. Nice deep breath here. Good. Not forcing anything, it's just a stretch. That's good. We're going to work similarly here. Here's the bottom of her rib cage. Her ribs come down this way, and her hip bone is here. And because of that rotation that's in her spine, where her spine is rotated this way, I'm going to work it the other way and get a little separation here between the lower ribs on the right and the lumbar spine. And it's gentle, just a gentle push. As I was working on her upper trapezius here, I was feeling some pull coming from the front of the shoulder along the biceps and also in the back of the shoulder along the triceps. If you know your anatomy, you know that the pec minor muscle that we were working before and the biceps muscle attached to the same place on the front of the shoulder. So very often tension in one is translated directly to tension in the other. And so I'm just going to gently right now work along her biceps in the front. You might want to come around so you can see what I'm doing here. That's better. So with my right hand pulling along the biceps and feeling for tension, definitely finding some here. Your biceps muscle can pull your whole shoulder forward. A lot of people don't realize that. And then along the triceps here, not as bad, but right around here in the middle of it, getting a little bit of a hook between the triceps and the humerus, and we want to make sure that that's moving. And that gets moving pretty easily. Did you ever injure this elbow or shoulder?
Mm-mm.
Good. Good. So this was just our first treatment. And this is just the beginning of how to help an adult with scoliosis improve muscle tone and mobility of the ribs and shoulders, as they're often affected by scoliosis. Thanks for watching.